Welcome back to part 3 when we're talking about cardiovascular health and how well the heart is actually doing and the testing that we can do to even look further into this. And a lot of times when patients have their cholesterol numbers looked at, they don't have their sugar numbers looked at. And the important piece of why you need to do that, I want to explain right now. So we're in the middle of the summer right now, or the start of it, and it's grilling season. Now, if you were to take that grill wire brush and scrape it on your arm, okay, until your skin's irritated, and you did that every day, okay, what eventually is going to happen to that skin right there is we're going to develop a callus. It's going to become really inflamed, it's going to be red, and it's going to be calloused. Well, when we're consuming sugar and high levels of sugar on a daily basis, okay, that same thing that happens when we scratch our arm with that wire brush is what's happening to our arteries on the inside, where that sugar is going to cause tears, small tears in the arterial walls, which over time is where those bad cholesterol is going to develop, and now we're going to have plaque collecting into there, and those arterial walls are going to be smaller. So that's why the sugar numbers are super important when we're looking at cardiovascular health. Now, one of the most important numbers to look at isn't your hemoglobin A1C, it isn't your glucose that day you go in, it's not your GSP, it's actually your HOMO-IR. And what that is it's looking to see, is your body's insulin resistant? Okay, so it's measuring to see when you intake sugar, is your body able to properly figure out how much is there, how much insulin needs to be created to create that balance within the body. And when that system starts to fail, okay, that's an indicator of prediabetes or even worse, diabetic, okay? And the cool thing is, if those numbers are off, if we look at type 2 diabetes, it's 100% preventable, and you can reverse it because it's a lifestyle issue. So looking at those numbers, knowing, are we pre-diabetic? Are we heading down that lane? Because we don't want diabetes in the first place, but to have that with heart disease, it's a no-no. So next piece is genetics. Stay tuned for that next part.